Good morning, everybody. Feels like it's been a rush job, going to Florida, doing a program, swinging around, coming back. And I'm at the Solstice place today. We'll be doing some things from here today. Have the consultant course. Have some things happening, keeping up with what's going on, and then I have a webinar tomorrow on end of life. I know that, and some other stuff happening. So, boy, it seems like we stay pretty busy. Is that true, or is it just me?
Yeah, Teepa, I would say that's pretty true. I wonder sometimes too when you have a moment to stop and actually take a breath.
Well, I can do that while I'm waiting in line at TSA or to get off the plane. If I can get myself out of the place of waiting, then I could use that time a little more productively. So sometimes I get a chance to do those things, or driving home at night and watching for the deer, but not getting too invested in that, noticing them when they're out, because they do that late at night. So one of the things that when you're in your new normal and you've discovered, look, we have dementia in the house, one of the things to realize is you do need to take stock of how you're spending your time. And that now that there's somebody who their abilities and needs are going to be shifting like they already were, but now there's an acknowledgement that this is a process. This is not just a one shot. Okay, we find out what it is, get it treated, and now we're good to go. It's like, and wow, okay. So now I'm going to have to really think about this, because I've got to find out, for me, I got to look at me first and go, okay, so what am I going to shift around, or what needs to be shifted around, or what do I want to shift, or what would I like to shift around? Or maybe I look at me and say, what am I good at and what am I not so good at, so that I'm going to definitely want someone else or support for that, because it's not my skill set and I don't actually want to develop those skills, versus, okay, there's an area I'm going to need to develop some skills. So what do you think some of the most missed areas are where we're going to need to develop some skills because we already think we know some stuff? Where do you think some, like for people who are going to be in direct contact with the human being who is now, we have heard, is for sure living with a brain-changing condition that is progressive, that is chronic, that's going to keep changing, and that is going to affect eventually all areas of function and ability. Where do you think it is we miss, where we will probably need to grow some skills if we're going to be successful? What do you think, Matthew? What's the primary area that we miss?
Teepa, I think what pops in my head right away is that helping somebody complete a task. Because I think often a lot of folks will think it's just as easy as just telling them, here, this is what you do. And then they'll do it no matter what. And so when they see that somebody...
Okay, so Matthew, I'm going to pause you because it's really funny. Where did you go? What do you know about complete a task?
So all of the steps that go in.
Okay, wait. So complete a task is at the end of what?
At the end of actually initiating, sequencing, and then, yeah. Oh,
so what you said is exactly what the issue is. People are worried about completing tasks when what's missing is, how do you help someone initiate something? But because we're thinking of completing, we've already missed. Now, you knew that. I know you knew that because you know a lot about brains. So what do you think people might think they know enough about, and so they don't go find out about how something works before they start trying to help somebody and use their own to help somebody's, when that's the thing that's changing?
Yeah. So know enough about the brain itself and what all the different parts do, and then how that particular type of dementia or diagnosis that they got affects the brain.
Oh, so really doing a little learning about human brains, because we think we've got one. Other people have them, we've used them our whole lives. So our brain tends to think, oh, I know enough about that. I need to focus in on other stuff. And it's like, do we? Because we use it, but I'm not sure. It's sort of like a car. When a car starts acting up, it's sort of like many of us know so little about cars that we go, I got to take it to somebody who knows what they're doing. And the person says, well, I think it's actually working okay. No, it's not. And then you finally identify, oh yeah, this has, and this is this. And it's like, oh, so what does that mean? Oh, well, if you can afford it, I'd get a new car. It's like, yeah, well, you can't get a new brain. So, or you can't just get it worked on and make it fixed. So it's a little bit different, but what we don't know about what's under the hood can cause us trouble. So I think sometimes we jump the gun and just sort of like, so what's possible? What's the categories of what is possible for brain? What do brains do? So I can be really aware, both as for my own brain, because brains control my blood sugars, my heart rates. I mean, yeah, they're based on messages back and forth from your body to your brain. Still, there's a lot of control that comes from the brain, and some of it's subliminal, which is I'm not aware of it. And some of it is I'm aware of, and some is more modifiable than we think. So one of the things we teach people is like, how about we just pause for a second and take a breath and blow it out a couple of times. Because what we know about that strategy, that's a very practical strategy for brain management. I mean, it helps you manage your brain. And what it helps you do is get oxygen to your brain. And we know that oxygen in your brain makes your brain more functional. It gives it what it needs, which is a fuel source, oxygen, nourishment, hydration. And so knowing about human brains turns out to be really important when you're suddenly going to be thinking about how you're going to support another one that's going to be changing. And I think, I tricked Matthew, but I mean, truly, I believe for all of us, it tricks us into thinking we move into, okay, well, this is where the issue is. It's in the symptom management, because we're focused on symptoms rather than why are we seeing those symptoms? And why aren't we seeing those symptoms? And we get excited because the person's not doing this, but they are doing this, but it's inconsistent. And it's like, okay, so what does that mean about the brain function? And learning more about brains, I truly believe, could help us let go of the idea frequently that the person is not trying, that the person is doing it on purpose, that I'm doing something wrong, that it's all on me, or it's all on, it's like, okay, so understanding brains and how they function and dysfunction, I don't think that's just the medical provider's job. I think all of us could own our brains a little bit more and understand them a little better, so that we figure out a little bit of how brains figure into this mix, because it's a big part of who we are, how our brains work and don't work, because they affect emotion, they affect physicality, they affect eye gaze, they affect putting things in my mouth, how I use my hands, how I process auditory stuff. So if I understand my brain better and how brains work, and my other person's brain better, then it might give me insight into ideas about, okay, so when this happens, I'm not a good match. That's what I can tell you. I'm not a good match when this happens, because it affects my brain as much as it affects the other person. And from my talk yesterday, it was like, I wonder if your mom's the best match for your dad when he's saying he doesn't want to take a shower. And she goes, yeah, I don't have as much trouble as she does with him. And it's like, wonder why that might be. And helping the person problem solve through what is it about their two brains together and their relationship compared to mom and dad. But it's working through those ideas and understanding what brains like don't like, what they need. And so that, I think, is a big missing piece of the puzzle. So for today, that's really my primary focus is, what do you know about human brains? And what do we want to know, need to know? What would we like to know? I mean, you don't need to go to a college course, but I think understanding how your brain is put together and how everybody's brains are put together, but we have a very neurodiverse neurodiversity means we're each different. And there is a lot of diversity, differences. And I need to learn to respect those, but I also can really acknowledge, okay, well, that's real different. That's different than what my brain would have done. It's like, okay, well, wonder if that's a lifelong difference, or is this something different due to dementia? Oh, it's due to dementia, we think, because it's real different than it used to be. So wonder what's triggering it. Could it be environmental? Could it be relationship based? Could it be time related? Could it be fuel or resource related? Wonder what it could be. Because by starting to become a problem solver, to solve problems, you got to know your A plus Bs. And sometimes they don't equal Cs. But so, it seems like a little thing, but I think sometimes we jump in to a fix mode rather than really doing a careful preparation for what I'm going to need, which is, one of the reasons people encourage me to go back and do Understanding the Changing Brain, that book. We did the book, not because I wanted or needed to do the book. It was because when we looked at what seemed to be missing for people, it was understanding how brains are and what they do and how they change. And it's not just about dementia, it's just understanding ourselves and our brains. So we quit thinking sometimes that it's all the other person, or there's nothing I can do. And it's like, well, that's really a defeatist attitude. So there you go, Matthew. I rambled on a good bit, but what are you thinking?
Yeah, no, and Teepa, I have to admit, my response came from a place of what we see a lot of, which is how can I help somebody? I just need to know how to help them because they can't seem to do stuff. And so how do I help them? But getting that piece of why we're seeing what we're seeing, taking that step back and being able to understand and seeing the brain, especially, I don't know how many times I've seen that light bulb pop in somebody's head when they see two different brains side by side, and they see the healthy brain and then they see the brain of somebody who had been living with Alzheimer's for 10 years or a dementia. That moment gives people that connection of,
And the next statement is always, not always, but quite frequently, I wish I'd known this, which is where my aha comes from, because me too. I wish you'd known this, because that's not fair to give you a condition, a syndrome at least, if even not a diagnosis, a syndrome identification, and not help you understand what that means. What does that mean? It doesn't mean memory loss, and it doesn't mean a word. It doesn't mean Alzheimer's. What it means is there are going to be some changes in the brain, and you're going to want to watch out for them a little bit. And there are going to be changes in your brain. You're going to want to watch out for those and appreciate them. But you can also make changes in your brain. And that's the really cool part, frankly. So there you go. Message for today. I think one of the most important changes after a diagnosis is to start to understand brains, because I think we skip a step. And when we start skipping steps, it's easy to get into us versus them, or saying simple things like, well, I've had trouble finding keys before. And for someone who's just found out that they have dementia, that's not necessarily a helpful comparison. If I said, I've had trouble finding keys, but I don't think it's the same as what you're experiencing. So not being able to find things where you expect to find them and then finding them somewhere else, I can't imagine. That has got to be really hard. Because then I'm acknowledging my life experience and yours, it can't be exactly the same anymore, because then I diminish what you're experiencing. And that makes you feel less, or makes it feel like I think I know something I don't. So learning the art of using my brain, comes next. But that's sort of something after you understand the brain a little bit, you can start to go, okay, so what can I do now? Yeah. All right, everybody. So till next time, take care with care and consider taking a look in the mirror. But you're actually not going to see what I'm talking about. You got to look at pictures, because looking at yourself when it's inside, it's a little tricky. Just saying. All right, Matthew. Till next time. Bye, everybody.
Bye, everybody.